Welcome back to the anatomy series of videos. Today we're going to be looking at the foot and the ankle, and once again we'll be using the Complete Anatomy software, which you can download yourselves, and you have free access to. Login details available from the library, and we'd certainly encourage you to follow along and use Complete Anatomy to develop your anatomical knowledge. So when we consider the foot and ankle, it's worth remembering that there has been an evolutionary journey to get us to the point where we are today. There is a lot of theory and there has been much written about the evolution of man and our relationship with our close ape cousins. And a lot of people sort of look to the chimpanzees and the gorillas to think, yes, well, we're only between 1.2 and 1.8% different in terms of our genome. Therefore, we must have come from that area. We must have developed from that line. In fact, it probably goes further back than that. And I think most theorists now believe that we probably, in terms of our foot structure and our the way we sort of stand on 2 feet, we're probably more closely linked to orangutans and that sort of area. We were probably going back 3 million years, tree dwellers, or at least tree walkers and hunters and gatherers in that sort of arena. Our longer arms maybe suggest that we used to reach out on branches. We maybe needed to gather our food from the end of branches. It's safer to be off the ground. We needed to be able to walk around. We'd lost our tail by this point, and so it was reasonably sure that we had to be able to grip with feet and hand. As evolution, as maybe environment change, and there's a theory of the environment actually being one of the adaptive influences on the evolution of the foot. The tree lands shrunk, the savanna plains grew, and if we sort of accept the idea that we are from Africa, these savanna plains begin to explain a lot. I like to take the podiatrist view of the foot. And that is that the foot is a mobile adapter. And by that I mean it's perfectly designed to cope with uneven surfaces. We evolved in an area where pavements didn't exist. Flat surfaces were rare. And you can picture the savanna plains, and as we sort of descended from the trees, as the environment sort of became increasingly grassland, it made sense that we were able to move quickly through the savanna and get over the sort of short grasses, the tufts, the clods of earth. And so if you imagine stones and lumps of grass, our foot is perfectly designed to get over and adapt to these changes in terrain. The foot itself, therefore, could be viewed as this mobile adapter. And there's also another famous talk from Bramble in 2004, where they actually look at the human foot and argue that it was born to run, and it is almost incredibly fit for the purpose of running. If you have ever taken your shoes and socks off and run on grass, it's actually very difficult to heel strike. It's very difficult to tell your brain that it's okay to land on that vulnerable part of the foot. And it's okay to land on the middle of the foot, which is very sensitive and actually is more about stability and proprioception, where all those nerve endings are. And actually moving forward onto the forefoot, where all the propulsion is and the elastic energy stored in the tendons is made most use of, makes a lot more sense. So here we are in Complete Anatomy. We're going to take a look at the foot and the ankle. And let's just remind ourselves quickly that the main bones here are the tibia and the fibula. We talked about the proximal tib-fib joint, which is up at the top end. You might see my cursor there. This proximal end, or the superior aspect of the fibula, but the proximal joint, tib-fib joint, actually does move a little bit. And if we just move that round, you can see that the fibula actually is a non-weight bearing bone. It is there to transfer load from the tibia by way of the interosseous membrane and muscle attachments. So what happens as the foot dorsiflexes at the distal end and plantar flexors and inverts and everts is that the small movements at the distal end are matched with opposite movements at the proximal end. So the fibula is rocking backwards and forwards like this. And if you go into extreme dorsiflexion, you can actually put your fingers and palpate on the proximal tib fib joint, and you can feel the fibula moving slightly. And it's important that that range of movement is there if we're to accept that we want to achieve full range of movement at the ankle. So post-injury, this is one of the mobilizations that you might consider, where the lower limb is stiffened through injury. Let us look at the ankle in a little bit more detail. So I'm going to zoom in and we can look at the bony structures. At this distal end, we have what you can see there is if I just highlight the talus, this is the articular surface of the talus, you can see what we call a mortise joint. And this is the actual ankle joint itself, if you like, where dorsiflexion and plantar flexion occur. Synovial hinge joint, although there is a little bit of extra movement in this area, because if you look at if I just temporarily hide the fibula, you can see that there is a dome shape to the talus, the articular surface. So this allows it to plantarflex and dorsiflex. However, there is a little bit of posterior translation, so the talus will move further back and it will move slightly out towards the fibula. There's a slight bit of rotation. We're going to put those back in so you can have a look. So there will be a little bit of rotation which will push the fibula back, and therefore you can't call it a proper hinge joint. It's more of a modified hinge, much in the same way the primary function of the knee is a hinge, but there's also rotation. The primary function of the ankle is act as a hinge in plantar flexion, dorsiflexion, but there are other movements. The difference is that in the ankle is that these are accessory movements and not under our physiological control. And that's something to bear in mind as you move through physiotherapy and sports therapy in terms of re-establishing movement and range of movement and ease of movement in the joints post-injury. So we have this mortise joint formed. There are plenty of supportive ligaments in this area. So if I just put them on, you begin to see how this is made up. We'll just take those tendon sheaths off. Strong ligaments, especially here with the syndesmosis or the anterior tibia fibula ligament. This is one of the injuries that's sustained when a high ankle sprain is experienced. It can lead to instability around this area, which is quite a traumatic injury and takes quite a while to heal, because the constant walking on the ankle will continue to splay that area. But its primary role is to stop that splaying out and secure this mortise joint. I'll take some of that connective tissue back off again so we can look again at the bones in more detail. The area on the medial side here, this is the medial malleolus formed by the tibia, and then we have the lateral malleolus formed by the fibula. And they're the two bony outcrops at the end of your ankle. Traditionally, if somebody said point to your ankle, you would probably point to one of those malleoli. We'll just move the ankle around a little bit. So as I said before, if I can remove the fibula, we've got the dome shape there of the talus. Actually, underneath it, we've got the calcaneus. And the calcaneus is where this is also known as the subtalar joint, and this is where inversion and eversion occurs. And if I just quickly remove the talus, you can see that the shape there is a sort of concave dome. It's the other end of it, and this allows that inversion eversion to occur. I'm going to put back in the talus, and I'm going to put back in the fibula for now. Once we move into this area of the talus and the calcaneus, they're the two larger. We're into the bones in this area. We're talking about the tarsal bones now. The tarsal bones, much like the carpal bones in the wrist, contribute to stability in the ankle. The two largest are, as I've said, are the talus and the calcaneus, and in front of that we have the navicular bone, the cuboid bone, and then we've got three cuneiforms. We have the medial, the intermediate, and the lateral. Now these bones have quite a solid bony congruity, but interesting to see the difference between the medial and the lateral side. Remember, the foot has arches. We've got a medial longitudinal arch. We've got a lateral longitudinal arch. Just going to move my ankle back in. And we have a transverse arch underneath. If I add in the connective tissue and we look at some of the ligaments, we begin to see a relationship between the bony congruity and the stability of the ankle and the ligament structure. Probably better if I put the ligaments in, you can see this. So on the lateral side of the foot, we have a much lower arch and we have larger bones, and they are very tightly packed together. This adds to the stability on the outside of the foot. And if you think about us, the foot is the mobile adapter, born to run, and obviously primarily a locomotive limb, the lower limb, then you begin to realize that there's a reason for that stability on that side. Just think about how we walk and how we run. Because of the extra bony stability, the ligaments on this side are actually smaller and thinner. Most commonly injured is the ATFL, the anterior talofibular ligament, along with the calcaneofibular ligament. Around the back, we have the posterior talofibular ligament, which is just hidden under there. Just put those back. So we have thinner ligaments on the lateral side, more commonly injured. If we move to the medial side, we've got a higher arch, we've got less bony congruity, there are fewer bones on this side closer to the ground, and therefore we have stronger ligaments. And I actually will just add in a layer of ligament here so we can see the full scope of the deltoid ligament in this area. And you begin to realize that with the tendons around here, there's definitely a relationship between the suspension of the arch, the structure of the ligaments, and the position of the tendons. And if I was to move back around to the other side, tendons, there's two of them mainly involved in plantarflexion and eversion at this point. We'll come to those tendons when we look at the muscles in a bit more detail, but it's clear that there's definitely a relationship between the bony congruity, the strength of the ligaments, and the arrangement of the tendons. So I've spoken about the foot being a mobile adapter and its evolutionary purpose, and the theory that we were born to run. And this is sort of quite well supported when we look at the major muscles and ligaments in this area. If I add in our muscular system at this point, I'll take out some of that connective tissue. You'll see that there are, again, like the upper limb, we've separated the posterior, the anterior, and lateral compartments. The deeper layer of muscles have a function, the intermediate layer of muscles have a function, and the superior, or the most superficial layer of muscles have a function. Most people will be familiar with the large tendon at the back. This is the calcaneal tendon, which is also known as the Achilles tendon. It's actually a combined tendon for the triceps sura group. Sura coming from the Latin for sandal, and the soleus muscle and the gastrocnemius make up the triceps sura. The two muscles that make this up contribute to plantarflexion, but the size of the tendon begins to explain the amount of power that can be transferred. And obviously plantarflexion, toe off, and propulsion is where the power comes from for forward motion. So this needs to be big, it needs to be strong, it needs to be elastic, it needs to retain its energy to let it go. It's impossible for us to store or to have muscles big enough to just solely push us forward, we need to store energy from impact and release it in a sort of plyometric fashion. Talking about propulsion, we should mention right now this muscle here, flexor hallucis longus. This is a very strong, very powerful muscle. Its attachment point on the big toe is positioned to aid toe off. So the soleus, the gastrocnemius, and the flexor hallucis longus are the main propulsion muscles. Obviously, the muscles around here, flexor digitorum, brevis, and longus, which is running a tendon through there, coming through. Just if actually I'll take away brevis, and you can see then the tendon of longus there. Again, long, strong tendons involved in propulsion. Put it all together: flexor hallucis longus, flexor digitorum, longus, and brevis. Brevis is more for the toe, for the gripping, plus soleus, plus gastroc, and we've got a system of propulsion. Very efficient, mobile adapter, tightly packed bones, which a little bit of gliding and sliding. Other bones of the ankle and the foot, or the foot now as we are, other bones of the foot are the metatarsals from 1 to 5, and of course, just as it is in the hand, the phalanges there at the end. Same arrangement as there is in the hand: 2 phalanges on the hallux, 3 phalanges through the digits, through the toes. As I said before, we can split the lower limb muscles into compartments. Anterior compartment, tibialis anterior, extensor digitorum muscle. Move round to the lateral compartment. Debate whether extensor digitorum should be in the lateral compartment. I tend to look at the position of extensor digitorum and place it alongside tibialis anterior. Then we move to the lateral compartment proper, fibularis longus or peroneus longus. Soleus is in the posterior compartment along with gastrocnemius. Also in the posterior compartment, just hiding under here, flexor digitorum longus, and deep to it, flexor hallucis longus. There are other muscles in a slightly deeper layer, and we'll come to those in a second. Let's just go back around to the anterior compartment. Tibialis anterior, large palpable muscle at the front. Let's look at its action. Primarily is a dorsiflexor of the foot. But you can also see, because of its attachment point, because it's coming across at an oblique angle, then it is attaching on the inside, just there at the base of the first met, and is involved in inversion as well. So dorsiflexion and inversion together. Very strong muscle. Looking at extensor digitorum muscle, we look at the action of this. Again, we've got dorsiflexion hand in hand with tibialis anterior, but we've also got extension of the toes. Easier to see from that angle. Lateral compartment, peroneus longus or fibularis longus, depending on where in the world you're from. Now this muscle is has a few different roles. It's worth looking at its attachment point underneath, and you can see it beginning to disappear underneath all of these superficial muscles of the foot. Peroneus longus actually has a relationship with tibialis posterior, which is on the medial side, which I can just highlight, missed it, just there, tibialis posterior, and the two tendons come underneath the foot, and we're going to cover a few of the muscles, so I won't remove them just now, but it's worth looking at the way they work together, and they sort of stir up the arch, so they're like a dynamic stabilizer of the arch of the foot. Imagine a stirrup on a horse saddle. That sort of arrangement. It's providing that dynamic support underneath, and tibialis posterior muscle is often forgotten about in terms of its contribution to movement, plantar flexor and inverter. And if you think about tibialis anterior being a dorsiflexor and everter, you can see how the two work with each other, or are opposite to each other. Let me just move back round to the lateral side, because we can also see here we've got peroneus or fibularis brevis as well. So longus disappears down under the foot, brevis, shorter muscle, attaches to the base of the fifth metatarsal, and quite often this is a point of an avulsion fracture with a lateral ankle sprain. We look at remind ourselves that these ligaments here are small and much thinner. In fact, your ATFL ligament I'm highlighting there is probably about the size of your little finger. So, and that's a little fingernail, with a cut nail. So it's not very big and nowhere near as strong as the medial ligaments. So it's supported dynamically by peroneus or fibularis brevis. So in a very bad ankle sprain, if this is completely torn in a grade 3 injury, then a lot of force is transferred to peroneus brevis. And quite often the attachment to the distal end will avulse and pull away. Smaller muscle there, peroneus or fibularis tertius, just a small muscle which when isolated is just involved in dorsiflexion and a little bit of eversion. You can see its angle, it's coming under the retinaculum. If I just put in a bit more connective tissue, you'll just see that over the front is that retinaculum there. So all of these ligaments slide underneath it. Helps you understand the mechanics of it a little bit more. Okay, so we have looked at the anterior compartment, we've looked at the lateral compartment, briefly mentioned the posterior compartment, but let's just zoom out a little bit so we can get a better look at those posterior muscles. You begin to see gastrocnemius now coming into picture. Very large muscle, two heads, crosses over the knee joint, so it's a biarticular muscle. This means that it's most active when the leg is straight. So the knee in full extension, gastrocnemius is more active. If I can hide this away now, I will hide away the medial head, lateral head as well. We can see underneath it, we've got soleus. We take away that tendon briefly, and we can see soleus underneath. There we go. You'll notice that there's a long muscle here, which is plantaris, and not a particular strong muscle, and in fact is not present in everybody. So back to the soleus, because soleus doesn't cross over both joints, it's just uniarticular. It is most active when the knee is flexed, so gastrocnemius is slightly less effective biomechanically, and therefore soleus takes over. Now soleus is a completely different makeup fibre type-wise to the gastrocnemius. Gastrocnemius is fast twitch muscle which is involved in high force propulsion. The soleus muscle, on the other hand, is more of a postural muscle, slow twitch fibers with a lot of endurance, and this muscle helps us stay on our feet all day. Let's take it away and dig a little bit deeper, and now we can see some of these other muscles starting to appear. There's flexor hallucis longus. You can see it's a pennate and strong muscle that it has a very, very long tendon attachment coming up right the way through those muscle fibers. I'll take it away, and we can see tibialis posterior. Remember tibialis anterior around here, very long muscle involved in dorsiflexion and inversion. Spin this round. Tibialis posterior, a very long muscle involved in plantar flexion and inversion. Let's just look at that motion. It's worth seeing it in action. There we go. Very important stability muscle. Quite often people have poor control over tibialis posterior. Let us just hide plantaris because it's not a great contributor. And see what else we have here. Flexor digitorum longus. Again, involved in toe flexion. And plantar flexion. And they're the muscles from the posterior compartment, but deep. Let's move around and we'll just zoom in on the foot in a little bit more detail. And let's take off some of these superficial muscles. See what we're left with. Okay. So you can see if I put that other image there, we actually have a fairly complex arrangement of tendons. Take the bones away and you can see how all of these muscles, similar to the hand, we have similar muscles down here in terms of the interosseous or the interossei muscles that help us with the toe extension and flexion, adduction and abduction. We've got a very interesting muscle here of extensor digitorum brevis, which is actually solely a foot muscle. We come under here, we have the lumbricals, just as we have in the hand, we have lumbrical muscles in the foot. Again, similar sort of actions, so if you've revised your hand, you know that well enough. Similar sort of actions in the foot, make life a little bit easier for us, finally. You'll notice that there's also a muscle here, which is the quadratus plantar muscle. Now, let's just look at the sort of motion of this. This is pulling through very strongly on these tendons and is actually attached to this common tendon above it. So it's a rather unusual muscle. And much like the muscles below it, if I just stop that, move back. Much like these muscles here and the tendon of digitorum involved in toe flexion, but also in aiding the foot as this mobile adapter. So very complex area. Now there is one more piece of connective tissue which is worth just adding in again. And that is this huge structure here, which is the plantar aponeurosis, or the plantar fascia as it's sometimes called. This is also supporting that arch of the foot and contributing to the elasticity and also storing energy for propulsion. Very thick, very strong connective tissue, and quite often can get irritated, and it's normally palpable around this attachment here at the proximal end. So I hope you can see that whilst there is a complex arrangement similar to the hand, the two are not unrelated. There are many common features. So if you understood the hand and wrist, the foot and ankle should at least follow a logical order. The differences are that this is a locomotive limb. The lower limb is about locomotion. The upper limb is about function. So everything is bigger, it's stronger. The energy that passes through the area is greater. And the way the information is fed back to the brain contributes to slightly different function and awareness. Our proprioceptive functions down here are slightly different. Like I say, the upper limb is about function, the lower limb is about locomotion. The design of the bones is important. The bony congruity on the outside with fewer ligaments or smaller ligaments. The medial aspect, which has less bony congruity but tougher ligaments and more tendons. The way the tendons, the long tendons contribute mainly to locomotion and propulsion, and the smaller muscles and tendons contribute to that foot as being a mobile adapter and for quick adjustments and gripping as we're running and moving. Remember that we didn't have, in evolutionary terms, we didn't have shoes, we didn't have fantastic trainers. We've had to develop those to cope with the surfaces that we've introduced. So as you know, we introduce flat, hard surfaces. It makes sense that we need to fill the space with the different shaped soles, arches, spongier soles on trainers for heel strike running, which you wouldn't do if you were barefoot. So that was a summary of the foot and ankle. We've looked at the bones, we've looked at the ligaments, and we've looked at some of the muscles. It's important to think of the foot and ankle in terms of its function. Think of it as a mobile adapter. That's the way that podiatrists look at it, and those guys, spend 3 years, they really love their feet. 3 years studying the foot, they know what they're talking about. And if you begin to think of it like that, the anatomy begins to make sense. If you think about how we've evolved, the purpose of the distal part of our lower limb is to move us efficiently, effectively, and to allow us to adapt to our terrain. Our next and final video of the anatomy series will be on the spine. Thank you for joining us for this one, and we'll see you in the next video.